Well, hey there. My name is Daniel Black. I'm a nurse practitioner with Optima, a managing partner there. Today, we're going to talk about TRT injections, both how you're going to draw up your medication and administer it safely. Now, while drawing up your medication is a simple process, we do want to make sure that we do it correctly and accurately. I'm going to show you a few tips and tricks for how we can draw up your medicine with the least amount of waste. This is important because testosterone is a controlled substance, and we do want to make sure that your medicine lasts as long as it should before we're able to send you your refill. So you just got your medication and supplies in the mail, and it's time for our first injection. The pharmacy will send you 3 different supplies. First will be your 1 milliliter syringe. The second will be an 18 gauge draw needle. This will be what we use to get the medicine out of the vial. And finally, you'll have a 25 gauge injection needle that you'll use to actually administer your medication. First, we're going to take your syringe out of the package as well as the 18 gauge needle. This is our draw needle, what will get the medicine out of the vial. These are sterile supplies, and we do want you to be mindful as you connect them together to keep them clean. This is a lure lock connection, which means that they will twist on lefty-loosey, righty-tighty. Next, we need to take your testosterone vial, which will have a foil cap on it. You need to peel that back, take an alcohol swab, scrub the top, and let it dry for a couple of seconds. It's the drying that actually kills the bacteria that could be there. For this example, we are going to be injecting 0.3 milliliters of testosterone. Please check your prescription and your provider to make sure that you're giving yourself the correct amount. We're going to pull up 0.3 milliliters of air into our vial because we are going to be injecting that into this vial to make it easier to pull up our medication. So go ahead and insert the needle into the vial, push the air in, and now we are going to go ahead and pull up our medication. Testosterone is going to be in an oil-based carrier, which is why it's going to be thick and why we use this large needle. Now is the time to get out any air bubbles that are going to be in your syringe. We can also feel free to manipulate and do any sort of flicks if needed. Now that we have 0.3 milliliters, we'll go ahead and take our syringe out. And if you notice, if you look at the top of this needle, there's still medication there. We need to make sure that we get that medicine. So what I want you to do is pull down on your syringe to where we get all the medication out of this needle. Once we do that, we're going to safely recap this needle, take it off, open up our 25 gauge injection needle. We're going to place it on the same as before. And now we are going to push all the air out of the syringe. As you watch, you can see the medicine go up through the needle, and at the very top, you can see a little bit of medicine come out the top. Now we are ready to do your first testosterone injection. Now with testosterone, there's 2 main places we like to inject. One is going to be the gluteal muscle, the other is going to be the vastus lateralis, otherwise known as the side of the thigh. My preference is gluteal, so that's what we're going to start with. You can either go right or left-sided. If we do the right side, you take the buttocks, cut it into fourths, and the top right quadrant is your injection site. With the left side, cut it into 4 quadrants, and top left will be your injection site there. When we do our injection, we always start with hand hygiene, so whether that be with alcohol sanitation or with soap and water, make sure that our hands are clean and that you have everything you need close by. Today we're going to be doing the right glute, so I'm going to put more weight on my left foot. This way, the right will be more relaxed. A relaxed muscle means we're going to have less discomfort as we do our injection. So we're going to have our alcohol swab. We're going to locate that upper right quadrant. We're going to go ahead and clean the entire site and allow it to dry for about 5 or 10 seconds. For our injection, we are going to go in quickly at a 90-degree angle. The faster you dart this in, the less discomfort you're going to have. 1, 2, 3.
Now that it's in, we're gonna slowly push our medication in across about 5 or 10 seconds. The slower that you do this, the less stinging and burning that we're going to have. Once you're done, you go ahead and pull out your needle. If you need to put a Band-Aid on, now would be the time to go ahead and do that. We always cap our needle without
Poking ourselves, so that way we can have safe disposal. After your injection, it might feel normal to have a little bit of discomfort, a little bit of swelling there. That should go down within about a day or so. If you do have any concerns about your injection site, please feel free to contact us. And of course, feel free to re-watch this video until you get comfortable with the process of doing your own injection. We hope you have found this video to be helpful, informative, and educational for testosterone replacement therapy. If you have any questions, comments, or concerns, we're still here to help. Please reach out to us. And for any other testosterone-related needs, feel free to contact us at the clinic, and stay tuned for more educational content from Optima.